Allowing Darya and I to speak a little bit today about ethylene oxide and some of the upcoming opportunities, how healthcare professionals can get involved. My name is Sarah Bucic, and I am with the Alliance of Nurses for Healthy Environments. And I'm joined today with Darya Minovi from the Union of Concerned Scientists. I've been a nurse for more than 20 years, and I've been with the Alliance of Nurses for Healthy Environments for the last 2 years. And we work on a lot of different types of things. A lot of our work focuses on climate change, but we also have a significant amount of work we do around toxics, around things like lead and ethylene oxide and things of that sort. So I will hopefully give you an overview today of ethylene oxide, and let me know if you have any questions as I go through this. So just a brief background about Annie is what we call our organization because we have a long name. We're the only national nursing organization that specifically works on the intersection of health and the environment. So we work with a lot of other national nursing organizations, and we work with groups like the American Nurses Association, and we actually have a lot of really great resources. We have an environmental health textbook. It's free. It's on our website. So I do encourage you to check out our website. But that's just a little bit of background. We work on, in addition, like I said, we work on climate change, but we also work on air, food quality, safer chemicals, the greening of hospitals, and we look at chemical exposures in homes, workplaces, schools, and communities, and we also look a lot at things that affect environmental justice. So we appreciate you allowing us to talk to you today. We're going to have Darya, who's joining us today, who's an incredible researcher with the Union of Concerned Scientists. And Darya is a senior analyst for the Union of Concerned Scientists for the Center of Science and Democracy. And this is a little bit about what UCS does. They put science into action to build a healthier planet, a safer world. And Darya is going to go a little bit into detail about something that they were approached about and some research that they were able to do on ethylene oxide involving communities. So last year, the Union of Concerned Scientists had reached out to the group I'm with, Annie, and they've done a tremendous amount of work. And Annie started getting involved in the ethylene oxide issue. So I'll just start there with what it is and why we're here today. So if you're not familiar with ethylene oxide, it is a colorless gas, and it is used to sterilize medical equipment. It's also used to sterilize some spices, some food products, and about half of all medical equipment in the US is sterilized with ethylene oxide. So according to the FDA, this is about 50% of all medical devices. That's about 20 billion devices each year. So it's an incredibly effective sterilizing agent. We'll get into some things later on in the presentation that there are other alternatives, but we'll also look at some other aspects of ethylene oxide. There are different things it's used for. For example, where I live near a facility that does not use it for sterilization. They do something with plastics and they emit ethylene oxide. So there's a lot of different releases of this gas. It also gets released when making solvents, plastics, and some pesticides. So the facilities that emit ethylene oxide for sterilization, this is a sterilizing plant on this slide. They often look like really nondescript warehouses. You've probably driven by them. They really don't look like what you're expecting. If you're expecting a chemical plant, they don't have large stacks. If you're imagining a chemical facility, it's not going to look like that. Most of the emissions that come out of these plants are from fugitive emissions. So they're not producing it intentionally. These are unintentional or unregulated releases. So ethylene oxide comes out of the doors, windows, leaking equipment. And in many cases, these facilities are located near other businesses, schools, and residential areas. Like I said, they don't look like a typical chemical facility, so people often aren't even aware that they're there. And as I said, this is a photo of a sterilizer that the Union of Concerned Scientists provided to us. So why is it a problem? It is a carcinogen. So these facilities, while they are effective at sterilization, they are also incredibly dangerous to the communities around them and the people that breathe in these fugitive emissions. So if you breathe in ethylene oxide, it can increase your risk of developing cancer. If you inhale it, it increases your risk of white blood cell cancers and breast cancer. And this is a really big problem for children because ethylene oxide actually changes a cell's DNA. It's mutagenic. A lot of these facilities are located in residential areas. They're near schools, they're near daycare centers. So it's a huge problem. So it's really it's a tricky problem because this is a substance that's used to protect patients and healthcare workers. We just came out of a pandemic, so we were trying to make sure things are very clean, but this also causes harm to public health. So the big problem and why we're here today is ethylene oxide is not currently regulated to account for these risks. So it's a problem because those in healthcare and those in communities are kind of having to choose between these kind of false solutions like adequate sterilization and dangerous emissions. And so what we would like to see is, safer sterilization methods being promoted, and we'll get into some of those things. So just a little bit of background. The EPA does regulate emissions for hazardous air pollutants. And so the EPA does regulate 188 hazardous air pollutants, and that does include ethylene oxide. A hazardous air pollutant is something that is known or suspected to cause cancer or other serious health effects. So these hazardous air pollutant emissions are regulated from a bunch of industrial sources, and these are called source categories. This gets kind of problematic because facilities that sterilize medical equipment and food products, those are commercial sterilizers. But we know that there's about 7 source categories that emit ethylene oxide. And so because of this disjointed way that the EPA regulates these hazardous air pollutants, doing it by source category rather than by the pollutant itself, all these regulations are updated at different times. So it makes it incredibly complex. So under the Clean Air Act, the EPA is supposed to be revising and reviewing and updating standards every 8 years, but they are very behind. So emission standards for commercial sterilizers, which release ethylene oxide, they were supposed to be updated in 2014. And we're now going on almost a decade overdue on updated standards. So that was something that the EPA was working on in 2023. So about 9 years behind. And it's also important to understand that the broader context in which the EPA has known ethylene oxide as a carcinogen since 2016. So it's 2024 now, and in 2016, the EPA's Integrated Risk Information System, which is called IRIS, they released an updated risk assessment on the carcinogenicity of ethylene oxide. And these IRIS risk assessments are generally considered a gold standard. And their findings underpin many air pollution standards. So this 2016 assessment was really important because it determined that ethylene oxide was up to 60 times more toxic than previously estimated. So for the most current regulations for facilities that use and emit ethylene oxide are not based on this updated cancer risk value. So we really want the EPA to take this value seriously and update all their regulations with it. So Darya will be talking in just a moment here. Her organization, the Union of Concerned Scientists, has done a tremendous amount of work and released a really excellent report called Invisible Threat and Equitable Impact. And it talks about all of the communities that are being impacted by ethylene oxide pollution. And I really recommend you all take a look at this report. I will drop the link in the chat in just a moment. You can look at the scope of ethylene oxide's use in your community. There's maps you can click on. And the report has all kinds of maps so you can see one if one is in your community. And I am going to turn it over to Darya.
Thank you. And I guess I'll just let you know when to advance slides. Thank you so much. Hi, everybody. Nice to see some familiar faces. So as Sarah mentioned, UCS has been working on this issue for a few years now. We first became aware of ethylene oxide as a concern for communities in 2018 when the congressional representative for Willowbrook, Illinois contacted us and asked us to look into this issue. And at that time, we'd also been actively participating in and building relationships within national coalitions of organizations that were working toward broader chemical regulatory reform. And through this, we connected with some grassroots groups like Clean Power Lake County, which is a group in Waukegan, Illinois, where there's a sterilization facility. So just connecting with different communities that were dealing with this issue. By this point, there was also a lot of momentum for regulatory change at the federal level. In 2021, as you can see on the slide, the EPA's Office of the Inspector General published a report calling out EPA, basically saying that, as Sarah mentioned, they were overdue on updating emission standards for facilities that emit ethylene oxide, not just for sterilizers, but several source categories. And then there was also another report that stated that EPA was a management alert, actually, that EPA was failing to adequately notify communities about the known cancer risks associated with E2O exposure. Again, we've known since at least 2016 that it's a carcinogen, and because these facilities can be so nondescript in warehouses, many people had no idea that they were living next to a facility that was emitting a cancer-causing gas. Sarah, if you wouldn't mind clicking the slide. Thank you. In 2022, I think in an effort to address this concern around public communication, EPA did publish a set of risk assessments highlighting 23 sterilizers that they had identified as contributing to elevated cancer risks to surrounding communities. On the slide, you'll see their risk assessment for the sterilizer in Memphis, Tennessee. As you can see here, these residential communities that are adjacent to the facility face cancer risks that exceed EPA's, quote, acceptable risk threshold of 100 cases per 1 million people. And I'm sure we as environmental health folks can talk about what acceptable risk really means, but anything in the blue is above that 100 cases per 1 million people. While these risk assessments were incredibly important for raising awareness, there was a lot of media attention and sort of community advocacy that happened after they were published. There's still a lot of missing information here because EPA only provided data for these highest risk facilities. Communities like Waukegan that didn't meet the threshold still didn't have additional information about the facility in their community. And the other challenge is that these assessments aren't considering emissions from any other sources or pollutants. So sterilization facilities could be right next to each other. There's several communities where they're two right across the street from each other, within a mile from one another. Or there could be other polluting facilities in this community, but they weren't included in these assessments. And obviously we are, increasingly interested in this field around cumulative impacts and what people could be exposed to, because we are obviously not exposed to pollutants in a vacuum. So this was a sort of very narrow scope. And that's part of what spurred UCS's analysis, because our partners wanted a more comprehensive understanding where these facilities are located, not just the highest risk ones. Next slide, please. So over the last few years, communities have also beginning to connect the dots between ETO and health issues that they were experiencing. In 2018, as I mentioned earlier, the community of Willowbrook, residents there were alarmed after seeing EPA data that showed that they faced high cancer risk due to ETO emissions from a sterilizer facility. This community organized very quickly, and the facility actually ended up shutting down. And then throughout the country, other folks have slowly kind of started organizing. It's very much hyper-local to, there's a sterilizer in a community, and the neighbors around that facility have been organizing to form different community groups. So we've got Stop Sterogenics, there's Memphis Community Against Pollution, and these folks, in Atlanta, Georgia, Memphis, Tennessee, Laredo, Texas, just to name a few communities, really organized to try to, with the main goal being shutting down the sterilizers in their communities, but also trying to hold regulators accountable for ensuring emissions are controlled. Next slide. So going back to our analysis, since our analysis sought to demonstrate where these facilities are located and who might be most impacted, we started by collecting EPA data on these facilities, as well as census data on the communities that surround each one. As we developed our analysis, we were in regular communication with our partners at Clean Power Lake County, as well as other organizations that we work with. And in our national analysis, and there's a story map that we can share the link to, or you can get to from the report page, where you can see sort of interactive information about each facility. But through this analysis, we identified several communities across the country where we didn't actually have existing partners, but that they had high-risk sterilization facilities or several facilities clustered in the same community. And so before publishing our report, thank you for sharing that. We did an immense amount of outreach to those groups to say, you know, we realize you're working on this issue. This information might be helpful for you. How can we make this information more helpful for you? And also connecting with existing environmental justice or grassroots groups in those areas and flagging this in case it was something that they were concerned about. One other notable piece of this report is that we also identified many sterilizers located in Puerto Rico. It's actually really egregious, the situation with the number of high-risk sterilizers, particularly in proportion to the population and land area of Puerto Rico, as well as many in US-Mexico border communities. And so because of this, and also with our partnership with CPLC, we did develop Spanish language resources for this report, including an entire Spanish language version of our story map. And all of the data were made available to download in English and Spanish, so that folks could find this information about the facilities in their communities. Next slide. So broadly, our analysis looked at about 104 commercial sterilizers and a few chemical manufacturing facilities that are under a different source category, but it was about 96 sterilizers. So that was the vast majority of our analysis. We found that more than 14 million people live within 5 miles of these facilities, and there are more than 10,000 schools and childcare centers. Of course, the data on areas where kids are is important, given that it is a mutagen. We found that people in 12 communities across the U.S. Might be are in sterilizer hotspots, as we called them, because they were at least 2 or more facilities clustered together and had overlapping buffer zones, so people might face exposure from multiple facilities. We looked at EPA's air tox screen database and found that the air toxics cancer risks were greater in census tracts with facilities that have been ETO. That's not a surprise necessarily. And that importantly, that sterilizers are disproportionately located near people of color, people with low income, and people with who don't speak English as a first language. And especially found that like the cancer risks were greater in communities of color. The number of facilities that violated the Clean Air Act were higher in communities of color, and also hotspots were more likely to be in predominantly communities of color. So definitely a concerning finding, and also sort of went against the narrative around sterilizers. Because Willowbrook, this community that sort of was the first that gained a lot of media attention, is a predominantly white and more affluent community where they were very quickly able to organize and shut their facility down. But our analysis told a slightly different story, which is that by and large, these facilities are actually mostly located in communities that you often see highlighted in a variety of environmental, health, and justice issues. Next slide. Oh, was there an outcome slide before that, Sarah? There we go. So real quickly, so our report was published in February of last year, almost a year ago. And it was published just before EPA finally issued those updated proposed regulations for commercial sterilizers specifically. EPA is slowly going through each source category now, but again, almost a decade later, we finally got those, and there was legal action that Earth Justice brought as well against EPA for failing to update those. Because we'd done a lot of community outreach before publishing our report, there were a lot of groups that were able to use this analysis in their own advocacy, like the community in Memphis, where I showed you that facility, a local group there, Memphis Community Against Pollution, used this research in a legal petition to ask the local health department to declare a public health emergency and temporarily shut down the facility. The public health department actually told people to just spend less time at home if they didn't want to be exposed to ethylene oxide, which is, I don't really know what you do with that, but the facility, there was so much public pressure that the facility actually just decided to move out of Memphis. So we'll see where it goes, but that was a win for the folks there. And then Richmond, Virginia, they had a community meeting where they asked us to come speak, and then we're able to use that meeting to send requests to EPA to have an actual town hall for folks to talk more about it, and that meeting was granted. So there was definitely some concrete actions that folks and wins that people had. And then of course we use this analysis in comments that were submitted on the rule last year, and we're expecting a final rule to be issued by the spring of this year. So fingers crossed that this analysis and more importantly, the advocacy from folks who actually live near these facilities makes it into that. All right, that's it for me. Back to you, Sarah.
Thanks so much, Daria. So that's a lot to think about, and hopefully you all have some questions, so please do put them in the chat. So hearing all that, I just wanted to go over some recent EPA actions. So as Darya mentioned, the EPA did publish a risk assessment in 2022 for 23 very high-risk facilities. And we've seen progress and additional pressure on EPA to update standards over the last few years. In 2021, as Darya said, the Office of the Inspector General published a report calling on EPA to update emissions for facilities that emit ETO. And the report also found these facilities disproportionately impact communities of color and low-income communities. UCS actually participated in some lawsuits led by Earth Justice brought against EPA for failing to update the ETO emission standards as required under the Clean Air Act. And as I said last year, the EPA updated those produced those risk assessments for the 23 facilities. On this slide here, you'll see the risk assessment for a sterilizer in Memphis, Tennessee. And as you can see, the communities adjacent to it face cancer risks that exceed the 100 cases per 100 million people. And there has been a lot of pushback in recent years against the 2016 IRIS assessment. So that was that assessment that said, ethylene oxide is much more dangerous than previously thought. Industry groups have tried to cherry pick the data and pressure EPA not to use this IRIS risk cancer value, but thankfully the EPA is affirming that it will continue to use the IRIS risk assessment, which is great news. And after years of advocacy and public attention, we're finally expecting the EPA to update emission standards for facilities that emit ETO. So last year, Annie and UCS and a number of other groups, national groups, community groups, weighed in on the commercial sterilizer regulation that EPA proposed, and we expect that to be finalized and released this March. We are, however, expecting a new set of proposals to be released around hospital sterilizers. So there are a number of hospitals that actually have on-site sterilizers, and we do expect there to be some proposed regulations around those facilities. There's also the National Academies of Science, Engineering, and Medicine. They are currently taking up a study to review the Texas Commission on Environmental Quality's cancer risk value. And then there's ongoing conversations about that groups are having with FDA about evaluating sterilization alternatives. So this is one of those things where the FDA approves ways of sterilizing medical devices, but the EPA has oversight for the air emissions. And so these two agencies really need to work well together, and they need to hear from lots of people, which is one of the things we're hoping you all can get involved in. So this is the Union of Concerned Scientists Action Opportunities and Resources Network. These are great resources if you want to get more involved. Like I said, there is a hospital sterilizer rule coming out. It's expected this year. I know UCS is going to be having some information on that, and I know the Alliance of Nurses for Healthy Environments also will. Right now, we know that the FDA and EPA are hearing a lot from groups that are very concerned about, things like supply chains, and those are very important things. So we do need to make sure that all health voices are heard, including, healthcare workers, communities, people who are health is impacted. Because of the concern around a lot of regulations around ETO has a lot of industry groups discussing things, and that's can be very frightening to those making regulations. So we want to make sure all voices get heard. We hope that you can spread the word about what you've heard today. If your community has one of these facilities, you can reach out to your local EPA office, your state Department of Environmental Health, and see what they're doing about it. How are they protecting public health? Like I said, we really want healthcare workers, healthcare professionals, those in this section to get involved in this work. You can consider a letter of the editor, an op-ed, and you can reach out to Darya or myself for either one of those things. We know that there's a lot of hospitals that are actually eliminating ethylene oxide successfully at their facilities. We've had discussions with groups like Practice Green Health, and this is a leading membership organization for sustainable healthcare, and they deliver environmental solutions to hospitals and health systems in the US. And in their 2022 Practice Green Health Environmental Excellence Awards, they reported 256 facilities that have completely eliminated the use of ethylene oxide. So this is exciting, and this is showing that it can be done, and it can be done, without causing disruptions and things like that. There are alternatives to ethylene oxide, such as steam sterilization, low temperature hydrogen peroxide gas, plasma, peracetic acid, ozone plasma, and there's other alternatives available as well. So we know it can be done. This is Darya's information if you want to reach out and ask any questions. And then this is my contact information as well. This was actually a petition we ran last year. As I said, we will have probably another petition when these new regulations come out. So if you want to scan in the QR code, you can get, you can be part of our member list. It's free, and we won't spam you too much. And you can also reach out to me. That's my direct email address. So I want to open it up to questions. So if